Good morning. My name is Pietro Invernizzi, and I'm a professor of gastroenterology at the University of Milano Bicocca in Italy. And I'm currently the scientific director of the Fondazione IRCCS San Gerardo dei Tintori. Is a research of one of the top or endorsed by the Ministry of Health, Italian Ministry of Health, research hospital in Italy. But my story professionally is focused and dedicated is dedicated to rare liver disease, in particular autoimmune liver diseases, in particular primary biliary cholangitis, primary sclerosing cholangitis, and autoimmune hepatitis. I'm working on these diseases since 35, 40 years. And along my story was a very important achievement, or I was largely involved, myself and my group, in the opening of the ERN, European Reference Network, on rare liver disease. That happens in 2017. I have to say that with colleagues and top expert on autoimmune liver diseases, European expert on this rare liver disease, we were already working together. We were a sort of community. We tried to apply to the European funds. At that time was FP7, I remember. And so we already were working all together. So when the Europe decided to open the ERN, we were the sort of founding community. And I remember when we met talking about the organization and the application actually to European to Europe of the for opening the ERN on rare liver diseases. And the three autoimmune liver diseases, all of them rare liver diseases, were part of the initial short list of rare liver diseases we selected. And actually at the beginning, one of us was the coordinator of the ERN, rare liver, and was settled in Newcastle in UK. And so as some of the coordinators, just after the opening of the ERN, had to quit the position, and another colleague, Anger Lose, still the coordinator of the ERN rare liver, started to act in this role, and because based in Germany, in Hamburg. So the story was very important at a level, international level, for cooperation and collaboration with these colleagues. What I have to say, for years was very small, the impact on the real life as a professionist, as a medical doctors, and in Italy, where we work, in our hospital, Italian hospital. So I, for a while, for a long time, and now is changing the situation also in Italy, but the institution at the national level, at the regional level, you know, in Italy we have a very regionalized health system, was lacking. So we were alone. Each of the center part of the ERN, rare liver, were isolated. And so we work on national levels on this disease with colleagues out of Italy, in other areas of Italy, but not because of ERN and the activities. Was something that we decided to do and to make more knowledge of the diseases, to have more centers throughout Italy, expert in autoimmune liver diseases. Now I'm talking about liver diseases. But as I said, not because that was a plan coordinated by a centralized European ERN level. So what we did, at some point in Italy, we had the opportunity to apply for some funds coming from Europe, named PNRR funds. And so as a community of medical doctors interested and active in not only in Monza where I work, not only my group, interested in autoimmune liver diseases, we applied and we received a large grant to build, actually to make stronger community dedicated to autoimmune liver diseases in Italy. And so part of this large grant we were funded, we decided to spend for launching a registry. We already, actually, I didn't say, we already opened a national registry on these diseases that was not strictly talking related to ERN activities, but we did, and we opened for the first disease, primary biliary cholangitis, in 2017, and last year we opened two registries involving nowadays up to 80 liver units in Italy, the largest and not only the largest liver unit in Italy, and first for PBC and now also for PSC and AIH, autoimmune hepatitis. And so we organized a sort of networking named ITA-ALD, Italian Autoimmune Liver Diseases Network. And we started 3 years ago to meet with an annual national meeting. The first, last year in Rimini, this year in Bari, next year will be in Genoa, and very important meeting at the national level. But thanks to the grant from PNRR, we decided to launch macro area, geographically talking, registries, very linked to the registries coordinated by the Monza and the IRCCS San Gerardo dei Tintori national registry. And so we identified 11 macro areas in Italy. Some of them were a single one region, such as I remember Sicily, Sardinia, Lombardia, and so on. And in other macro areas were 2 or 3 regions, Italian regions. And so we organized meetings, 11 meetings, regional meetings, where we, with a local or macro areas PI, principal investigators, we organized a meeting with all the hepatologists, or the largest number of hepatologists as possible in that area. And we presented the plan to organize a registries and a sort of also organization of hub and spoke level in that macro area. That with the idea that local community or regional community or macro areas community will act very strongly in a very strong relationship with the national level. That was already very linked to the European level. So we had 3 levels: European level ERN, rare liver; national levels, coordination of 3 registries of these 3 rare liver diseases, autoimmune; coordinated by one center, my center, with 80 centers. Now the number is growing, liver center in Italy, and very linked to the regional, or more when we say the last miles, very closer to the patient, where patients are. So that with the two main aim or objective or rationale, that to be more closer to patients and to have the knowledge of these rare diseases spread to the very last mile, the very general hepatologist or general general doctor, community doctor needs to know how to make diagnosis, needs to know better and be have updated knowledge of novel therapies, of how to manage patients, and which markers has to be used. This with the final goal to reduce the traveling. Patients nowadays with rare disease need, unfortunately, to move far away to look for and to be followed in a good center, tertiary level center that very often are far away. So this was done last year. We concluded all the 11 meetings, and the community, the experience was incredible. We had much more liver units, even the smaller one, the secondary level, the primary level hepatologist liver unit involved in the networking. And now we are collecting information. And for PBC, we now have in the database more than 4,000 information from 4,000 patients. And this is a very unique and a valuable activity, because we are collecting the so-called real-world data evidences with novel therapies, with novel approaches. And so we are monitoring the Italian situation related to this rare disease with a very also important scientific impact, because we are learning in real time. And we were very ambitious, and we are also collecting samples, biological samples, serum, plasma, liver tissues, blood, blah blah blah, and in a centralized way. So all these centers are shipping materials, and we are collecting. This is very precious for scientists, clinical scientists, and basic scientists to perform in future further research and for a better understanding of these diseases, the etiology, the pathogenesis, but also to develop better markers, biomarkers, and better therapies.